World in the shadow of the coronavirus. Worldwide, half of the students do not go to school, and many jobs are closed or work remotely. Some countries have strict rules on leaving home, while others just call for caution. The COVID-19 virus, which until recently was considered solely a problem for China, has spread throughout the world. Hello everybody. I hope you are doing well and feeling much better in this exceptional period of time. Welcome to your online English lessons again. Today's video is special, is really important. It is about the coronavirus, the corona pandemic in my country, Morocco. And of course, in this video, we're going to have a look at the definition of the coronavirus, the symptoms of this pandemic, the causes, the global effects, the solutions we may suggest to protect ourselves from the coronavirus. And at the end of the video, we're going to have a look at the lockdown pros and cons, or the lockdown advantages and disadvantages. Let's get started and have a look at the definition of the coronavirus. What do we mean by the coronavirus? The coronavirus disease is a member of the coronavirus family that has come from animals. It has never been happened before, and emerged in China in December 2019. The virus can be spread from person to person. Coronavirus is a newly discovered virus. It causes a disease called COVID-19. In some parts of the world, it has made lots of people sick. Corona is a Latin for crown, because under the microscope, these viruses look like a crown with spikes ending in little blobs, as you can see in the small pictures on the left. Now, what are the symptoms of this pandemic? Lots of symptoms are similar to the flu. You may have dry and itchy cough, like in picture number 1. Fever, like in picture number 2. Lots of sneezing, like in picture number 3. And even hard to breathe. You find it really difficult to breathe. Most of people who has gotten sick with this coronavirus have had a mild case, which means they don't feel anything. It means you will not feel the disease. But for people who are much older or who already have health problems, are more likely to get sicker with coronavirus. If anyone gets sick and feels like they may have coronavirus, they can immediately call their doctors and get help. If there is something you are not sure about, information, confused or worried about, don't be afraid to ask someone you trust. You have to consult your doctor if you feel any of these symptoms. Let's have a look now at some posts on Instagram during the coronavirus outbreak. Post number 1. You can see a student who is studying online. She's not happy. She said, although we do have online school now, it is not the same. Working from home is worse, as I don't care to admit. My work habits from home are not the best. This girl is struggling with distance learning. She finds it difficult to study from home. Of course, we are not going to compare studying at school with studying at home. All right? There is no comparison between the two. But we have to do our best. We have to study. We have to make efforts so as to succeed at the end of the school year. Post number 2. My mom is a nurse, so she has to face the virus. In fact, today she is at work. So this is a girl. She's talking about a family member, her mom, who takes care of Corona virus patients. She's a nurse. She works in a hospital. She can't be with her family. She's taking care of Corona virus patients, which is really hard job. Picture number 3 is a bit different. It's a bit positive. Although we are going through a horrific time, filled with all kinds of uncertainty, we are given the opportunity to spend more time with our loved family. This is a good example. A family that enjoys quality family time. They think that distance helps keep a relationship healthy and good, better. Now we're going to move and have a look at the causes of coronavirus. The virus appears to spread easily among people, and more continues to be discovered over time about how it spreads. Data has shown that it spreads from person to person, among those in close contact within about 6 feet or 2 meters. The virus spreads by respiratory droplets released when someone with the virus coughs, as you saw in the previous pictures, sneezes or talks. These droplets can be inhaled or land in the mouth or nose of a person nearby. This is how people get contaminated, okay? How people get the virus from each other. It can also spread if a person touches a surface with the virus on it and then touches his or her mouth, nose, or eyes. And that's what we are going to have a look at in this video. The prevention, the protection. We should protect ourselves and help stop the spread of the coronavirus by staying at home. Now we're going to move and have a look at coronavirus effects. Economic hardship is on the horizon for most of the world. Some animals will suffer. Why? Poaching will increase. Hunting will increase. It's illegally, all right? Illegal hunting will increase as law officers are staying at home because of coronavirus restrictions. People are losing their lives. The death rate of this virus is anywhere from 0.2% to 5% of those infected. Imagine. The phenomenon of the pink moon is going to be amazing this time. April 19th, 2020. Lack of air pollution will allow us to see it in its true glory. This is one of the advantages, or let's say an advantage or a positive effect. Other effects. Global carbon emissions have reduced significantly since the lockdown was announced. That's a positive effect. The canals in Venice, all right, a city, of course, in Italy, usually polluted by boat traffic, are now clear and you can see the fish. It's amazing, but we can't travel to Venice, unfortunately. The air quality in major cities throughout the world is so much better. Now, another problem, another negative effect, mental health threat. Experts are warning that the mental health of many people will suffer as a result of restrictions on social interaction and exercise opportunities, in addition to the inevitable anxiety triggered by the global pandemic. People are staying at home, of course, feeling depressed, feeling lonely, feeling negative, right? That may affect their health, mental health. Now we're going to have a look at solutions. As I told you, prevention is better than cure. Don't worry, act responsibly, act wisely to help stop the spread of the virus, to protect yourself from the virus. How can we protect ourselves from the virus? Here are some things you can do to protect yourself, your family, and your friends from getting sick. Number 1, wash your hands often using soap and water. Number 2, sneeze into your elbows. It is believed that coronavirus spreads through little liquid from our lungs. If you sneeze into your elbows, you can prevent germs from going far into the air. Number 3, avoid touching your face. Don't pick your nose. Don't touch your mouth. Don't rub your eyes. They are the places where the virus enter our bodies. Do not visit old people, especially those who have health problems. Of course, you should stay at home. You shouldn't visit your grandmother, your grandparents, family members, etc., relatives, whatever. Number 2, here, use a wipe or disinfect spray to clean mobiles, TV remotes, keyboards, sinks, toilets, door handles, light switches, as you can see in the picture, and other objects and surfaces that are touched all the time. Use a tissue while sneezing or coughing, then throw it in the bin immediately. Wash your hands frequently for 20 seconds and use a hand sanitizer with at least 60% alcohol if you have to leave the house. Stop going out. The kids are off, but that doesn't mean we can go to parks, beaches, and walk in big numbers. And this is a problem. This is how people get the virus. Stop touching your nose, eyes, and mouth. Stay home if you feel ill and don't travel. Use your sleeve to cover a cough or sneeze if you don't have a tissue. Try to stay busy at home, positive and happy, as I told you in the previous video. Now guys, we are going to move to the coronavirus lockdown, the pros and the cons about quarantine. So these are the things you can do to spend a good time at home. Read all those books you know you should read. You can get on with private study, which means studying online, working online, learning online. Learn a new language. That would be a good idea during the quarantine, during the lockdown. Help to get the house clean and tidy. Do some decorating. Maybe decorate your bedroom. Take up a new skill. Maybe drawing, painting, knitting. If there is an old musical instrument in your house, get it out and learn how to play it. If you have a garden, redesign it. Or just get out into the garden and listen to the birds. When you are out on your permitted exercise trip, you can clean up litter. Offer to help an older person if it is safe. Keep up with your social media, of course, to know about what's happening in the world, what's going on. Watch classic movies, and of course, watch the news. It's really important. Now we are going to move and talk about the things that you shouldn't do, you can't do during the quarantine, during the lockdown, during the spread of the coronavirus. You can't meet up with your friends. You can't go to school. You can't go to the beach. You can't go on long trips to the countryside. You can't go clothes shopping. You can't play games outdoors. You can't go to concerts. You can't attend sports events. You can't eat out, visit cafes and restaurants. Now, guys, finally, you feel good because you are helping to stop the spread of the disease. And maybe you can get on better with your family. You feel bad because you have lost a lot of your freedom. I know. Remember that this kind of virus can affect anybody. It doesn't matter where you come from or what country you are from. Don't forget, there are a lot of helpers out there who are working to protect us from the virus. We can take a part by keeping our health and stay at home to stop the virus spread to other people and to others. I hope this video is useful for you. Take good care of yourself. Stay at home. Enjoy your time with your family. And take into consideration these advice. Goodbye.